Mixed reactions over Nigeria's first confirmed case of coronavirus. Still dwelling on this, if you are a parent, chances are you are worried and have questions about just how contagious coronavirus is. You may also be wondering how to protect your children. In our next report, we highlight measures you could adopt. Have a look. As the novel coronavirus continues to record new cases around the world, questions have emerged about the effect it could have on children and what their roles may be in spreading the virus. Following the first confirmed case of coronavirus in Nigeria, the government has called for calm, insisting that its agencies are equipped to stop the spread.
We as Lagosians not to panic, that people should not be anxious, that government is on top of it, and that this is why we had an incident command, which is headed by the governor himself, Mr. Bagde Sanwo-Olu, about 3 weeks ago, that we instituted this. We were already prepared that should this kind of thing, the coronavirus break out in Lagos, we were going to be able to tackle it. And this is exactly what we have been able to do, to tell the public that we have activated our defense and all our systems to cope with what is going on.
However, authorities have not been as vocal about precautionary measures to protect Nigerians at crowded places, especially markets, bus parks, religious centers and schools. For some primary and secondary schools in Lagos, there have been varying levels of compliance with these measures.
We've watched videos to educate the children about the virus. I think that's the beginning of everything, so they know what it's about. So they are educated, which is a point of knowledge that they've gained. Around the school, we have hand sanitizers situated all over the school, so as they step out of their class, they can sanitize their hands. But ultimately, we advise them to wash their hands, because not just the sanitizer, which is antibacterial, but we actually show them the World Health Organization method of washing their hands. So every child in this school knows to wash their hand, and on every level of this, near their classes of this building, there are sinks and soap to wash their hands with. They're keeping personal space, so every child knows not to hug and touch a lot of strangers, or even minimize the touching amongst themselves as well.
This parent has been following the news about the spread of coronavirus and is determined to keep our children safe. But how exactly?
I've been reinforcing the factor of keeping them enlightened as to how to care for themselves by constant washing of their hands after play, before meal, when they've come out from outside, just at every time to constantly wash their hands and to teach them the right way to wash their hands. It's not just washing their hands, to teach them how to do it. And also, I have made it compulsory that they go with the mini hand sanitizers in their bag, and if they are not able to use it in school, when they are out there, they use it, and I'm sure, and minimal contact with other people.
The Chinese Center for Disease Control and Prevention in a report shows that, as of February 11, fewer than 2% of cases occurred in children under the age of 19, compared to 87% in adults between 30 and 79 years old. In addition, the U.S. Center for Disease Control and Prevention stated that children with confirmed COVID-19 have generally presented with mild symptoms, and though severe complications have been reported, they appear to be uncommon. So, are children more susceptible to the virus that causes COVID-19?
Available data shows that children are not more susceptible than others. In fact, they are less susceptible. A few studies done so far has shown that the elderly people who have an underlying condition like diabetes, other kind of problems before, are more susceptible and more die from that. The rate of the mortality rate with that group can get as high as 15%. But for young, healthy people, what you get, not maybe about 4-5%. And for very young people, it's much, much less than that. Generally, in the general population, you are looking at a mortality rate of about 2% only.
Even though it may seem that children are not as vulnerable as adults, measures should be put in place to prevent them from being infected.
the same thing you do to prevent adults and then getting infected. You know, the children are more all over the place. They have contact with the surface where the virus can be. So you want them to ensure that they take their, you wash their hand as quickly as possible. Keep them clean in most of them. Make sure they don't get anything that falls on the ground into their mouth. And also make sure that these simple rules of hygiene are even more strictly applied to them than with the adult.
The number of coronavirus cases has now surpassed 86,000 in 47 countries worldwide, and over 39,000 patients have been recovered. As federal and state authorities continue to curtail the spread of the virus, children and their family members should engage in usual preventive actions. Wale Fakile, Gist Nigeria.